By the way, remember, that's the answer to all clinical questions. When patient asks you any clinical question, what's the answer? That's the answer. Well, it's based on the science of the 3 phases of healing, and these tests, you can itemize out the test if you want, and they determine if you're getting better, if they determine that, what your problem is, if you're getting better, worse, staying the same, or end up with a permanent problem to some degree. That's the answer, remember, to every clinical question. Let me be clear in it, because this is a big topic. So you don't have to memorize 1,001 different answers to clinical questions. When somebody asks you a clinical question, the answer is, well, if you recall, how your body heals is based on the science of the 3 phases of healing. There's the inflammation, repair, remodel, number 1. Number 2, it's based on the tests that determine, remember, there's a lot of different tests, but there were 8 specific tests dealing with your particular problem. And you can itemize out the test if you wanted to. If you didn't want to, you don't have to. And then those tests determine whether they not only told us what the problem is, but those tests determine whether you're getting better, worse, staying the same, or end up with a permanent problem to some degree. So all we do is treat you for a period of time. It's usually about 12 visits. We re-examine and do those tests, and those tell us how you're doing. That's the answer to every clinical question. You can magnify one or another. I can go deeper into it by saying, let me do it one more time and I'll expand on it. Let me give you the total expansion, but you would not give the total expansion to every damn time they ask a clinical question. So let me do this. Let me give the full clinical expansion answer, and then let me give you the bare minimum. I'm still going to cover those categories though. Let me compare and contrast both of them, okay? So here's the long explanation. Any clinical question they ask. Well, Mary, if you remember, our bodies heal in 3 phases. There's the inflammation, repair, remodel. And the goal of the inflammation phase with therapy is to decrease pain, inflammation, and muscle spasms. The goal of the repair phase is to increase all your mobility, your ranges of motion. And then the goal of the remodel phase is to increase the strength of that injured tissue and the mobility of that injured tissue. So that's what happens. Now, how we know where you're at is there's 8 specific tests that we did. We checked symptoms as one of them, how you feel. Tenderness is one. We'll check the nerves. We'll check the orthopedic test, how well you're doing with your range of motion, your muscle strength. We'll check for any spinal degeneration. And the most important test is actually seeing how the bones are moving. Are they moving normal or abnormal? So those are the 8 tests that'll tell us if you're getting better, worse, staying the same, or if you're going to end up with a permanent problem to some degree. And so what we would do is we would treat you for a short period of time. Usually it's about 12 treatments, and then redo the test. And then we measure those tests. And that's how we know if you're getting better, worse, staying the same, or ending up with a permanent problem to some degree. So if we don't see any improvement with the test, if we see improvement, we can decrease the frequency of the test. Also depends on what phase of healing which therapies we want to do, whether it's more for pain or whether it's more for range of motion or more for strength. That'll depend on which phase of healing you're in. And then that'll tell us when we measure those tests, that'll tell us how you're getting better. So if you're getting better, we typically decrease the frequency of the treatment, and typically we will change the type of therapy we're doing depending on what phase of healing you're in. Now, if you're not responding at all, when we do these tests and you're not responding, then we may change the therapy to see what other therapy would work for you. And if that's not working, then we would consider sending you out for a consultation with another doctor. But that's pretty much what your care is based on. And that's how we know if you're getting better, worse, or staying the same, or if you're going to end up with a permanent problem to some degree. Now, that was the full answer. That was a robust full answer. And I'd recommend you just memorize it. And by the way, you should know that. I mean, you shouldn't even be able to graduate from chiropractic college without knowing that. That's like 101 of being a doctor. Okay. And now let me just dumb it down to a real short, if I was going to say it real quick and short, it would sound something like this. Well, Mary, how you respond, how well you heal is based on the three science of the three phases. So there's three phases of healing, number one. And then we do specific tests. There's 8 specific tests. Those tests tell us if you're getting better, worse, staying the same, or if you end up with a permanent problem. And then we retest those tests. We retest them every roughly 12 visits. And that alone tells us if you're getting better, worse, staying the same, or if you're going to end up with a permanent problem. See, that's the very short version. And then there's, anything in between. And then I can personalize it. So depending on the depth of the question, the seriousness of the question, is the patient getting ready to drop out of care on me type of question? Well, I'm going to go into great detail. If it's more of a casual question, it's going to be more casual. Okay. So that's what would determine if it would be a robust question or just, and also where are they at in a relationship? They ask you something about, they're not responding to care and they're asking about, do you think I should get a consultation? I'm going into great detail with that one because they're about ready to fire you. And at that particular point. So you got to determine where they're coming from when they ask the question, how deep, how robust your answer is going to be. But that's the answer. And you should just know that. And there's one other concept here, whether it's in great detail or just quick and to the point like that. But that's how you answer every clinical question, period. Oh, this is what I was going to say. Then you can personalize it. So after I covered it, then I can swing back around and personalize their test. In other words, where are they at? Which of the 3 phases are they in? And which tests are positive with them? See? So that's obviously going into it in much greater detail. That's how you answer every clinical question to some degree. The only question is how robust is that answer going to be relative on the perspective they're coming from? That's it.